If you're having sexual intercourse and want to avoid pregnancy, there are a lot of birth control methods you can choose from. What should you think about when making the decision? Here are a few things to consider. First, remember that everyone has different values and priorities when it comes to birth control. Some people want a method that is easy to get. Some people want a method without hormones. Some people want a method with hormones that can also help manage heavy bleeding, acne, and other conditions. Some people want to use the most effective method. This video will review options for all these priorities and more. You can get some types of birth control without a prescription, including male condoms, spermicide, and a progestin-only pill. You may need a thermometer for fertility awareness methods. All other methods and the female condom may require a prescription from an OBGYN or other healthcare professional. Some birth control methods use hormones and some do not. The hormonal IUD, the implant, the shot, the patch, the vaginal ring, and birth control pills all contain hormones. Hormonal birth control is safe for most people, but there are other options if you want to avoid hormones. All other methods, including the copper IUD, condoms, the diaphragm, fertility awareness methods, sterilization, and more, do not use hormones. Now let's talk about effectiveness. This means how well birth control prevents pregnancy. There are three methods that are the most effective. The IUD, or intrauterine device, which is inserted and left inside the uterus. There are two types of IUDs. One type uses hormones, and the other type uses copper. The implant, which is a small rod inserted under the skin of the arm. This method uses hormones to prevent pregnancy. Sterilization, also known as permanent birth control. This is a surgical procedure that is not meant to be reversible. It should only be done when you're sure you do not want a future pregnancy. These methods are very effective. Less than 1% of people using one of these methods will get pregnant in a year. The next most effective methods are the birth control shot, birth control pill, vaginal ring, patch, and diaphragm. In this group, the birth control injection is the most effective. It is given about every 3 months. The pill is taken daily at the same time every day. The patch is changed once a week. The vaginal ring typically is inserted for 3 weeks each month. The diaphragm is used each time you have sex. Spermicide can help this method be more effective. Using one of these methods, 6 to 12% of people will get pregnant in a year. You may have other goals for your birth control method beyond preventing pregnancy. Other common goals include protection against sexually transmitted infections, or STIs, making your periods more regular, reducing bleeding or cramping, or skipping or stopping periods, clearing up acne, and other health benefits. Male and female condoms are the only methods that protect against STIs. Hormonal birth control pills are often used to regulate or stop periods. And other hormonal methods like the IUD and the implant can make periods lighter over time. Several methods have other health benefits. For example, hormonal birth control methods can be used to help treat acne, endometriosis, and premenstrual syndrome, or PMS. Some methods have side effects. For example, the implant can make periods irregular. The copper IUD can make bleeding heavier. Side effects often get better with time. When you're thinking about birth control, remember that all types of birth control are safe to use for most people, and you can decide which one is right for you. Condoms that are made of latex or polyurethane are the best way to reduce the risk of getting an STI. No form of birth control causes an abortion, including emergency contraception. There is no one answer for the best birth control method. These are just a few of the things you can think about when choosing a method. Talk with your OBGYN about all the options to find the best choice for you.